Effective tomorrow at 12:01 a.m., we're expanding the masking policies already in place in many communities to the entire province. That means wearing a mask when shopping, when taking public transit, and when at work if you can't keep 2 meters between you and your colleagues. As much as possible, we also need to limit close contact with anyone outside your households. This will be especially important to consider as we look ahead to Thanksgiving next weekend.
Ontario is bringing in new measures after reporting a record number of COVID-19 cases for the second time this week. This afternoon, Premier Doug Ford announced province-wide mask requirements and some targeted measures in persistent hotspots. The province is also putting the concept of social circles on pause. People are now advised to limit close contact only to people living in their own household. The measures are set to kick in right away, but the big question is whether or not they go far enough. Ontario nurses are among those urging the province to impose much stronger measures to reduce the spread of the virus. Doris Greenspun is the CEO of the Registered Nurses Association of Ontario. She joins us from Toronto. Hi there, good to see you again.
Hi, Bashi. Good to be with you.
Okay, so let me just ask you that very sort of direct question. What you heard today, the new measures taken, is it going far enough from your perspective?
With all due respect to the Premier, too little, too late. Most of the municipalities already have the masking in place. So while this is extended to the province, RNO has been asking for, I would say, already a month. We asked for the strip clubs. Thankfully, that was closed. Indoor bars, indoor dining, inside sports and gyms. But if we don't do that now, we will see not 1,000 by mid-October. My view is we will see at least 1,200 to 1,500. Ottawa is already reporting that they are in severe stress. The public health unit issued a statement. The labs, the hospitals, they're extremely concerned in Ottawa. Peel, Toronto Public Health Unit, as you know, they issue a statement that if the province doesn't move, they will move by themselves. So we are absolutely urging the Premier to take this a lot further and urgently. Otherwise, we're going to end up in a complete lockup in this province, and that will be really difficult for the economy. So the sooner we take back things, the faster things will move, Bashi.
And from the perspective of the healthcare system, because of course, when we started the initial lockdown, that was the real focus, right? Trying not to overload the system. As you mentioned, Ottawa Public Health is signaling that they might be in a crisis, or they are in a crisis here in Ottawa. From the perspective of nurses, where is your level of concern about the system elsewhere in the province being overloaded?
Yeah, the system is overloaded overall. We cannot keep canceling, for example, surgeries of people that are quite ill. So it's not only about COVID and why we need to do this dance, this tango, as I said to the Premier, the partnership between the government putting into effect the public health tools that they have at their disposal and do it right away. And then the citizenship, all of us, making sure that we look after ourselves, our families, that we close the networks much, much tighter. This idea, can I go to visit this or that? This is the time now for us to take control of ourselves also, with the masking, with the much, much smaller hubs that we have, and actually with the physical distance and all of the things that we spoke on the first time, washing hands, etc. But all of that at the individual level will be insufficient if these other places remain open.
And have you talked to the Premier or the government to express this point of view?
Yes.
You have?
Yes,
recently?
we have. We issued a press release. We issued today. We have been asking also for a signal of thresholds. What does it mean? When you drive a car, you don't just go. There are lights, right? And you have the green light, the yellow light, the red light. We want to see those thresholds for public health measures so the public will understand what's going on, and the public also will participate in a much more serious way than
How did he respond?
now.
How did he respond? How did he respond?
Well, we didn't hear an answer. I have been asking that for 3 weeks. I keep hearing the thresholds and the signals will come. So today we actually issued the lights ourselves, and we said Toronto, Ottawa, and Peel are on red light already. This follows not only Quebec approach, but if you look at Victoria, the state of Victoria in Australia, that they already, I believe, with about 450, 470, they went into stage 2. Vashi, we're at 732 here in Ontario.
Okay,
So it's serious.
I take your point. Thank you so much. I appreciate you making some time for the program tonight. Doris Greenspun is the CEO of the Registered Nurses Association of Ontario. Canadians are being urged to tighten their social circles as the resurgence of COVID-19 gains steam. According to public health officials, there's been an average of more than 1,600 new COVID-19 cases reported daily in the past week. The majority of them, around 80%, have been reported in Ontario and Quebec alone. Ontario is reporting 732 new cases of COVID-19. It's the second day this week a new record has been reached. Most of those cases are coming out of 3 regions: Toronto, Peel, and Ottawa. Ottawa itself posted a new high today. In the wake of those new numbers, Ontario is bringing in some new measures. This afternoon, Premier Doug Ford announced province-wide mask requirements and some targeted measures in persistent hotspots. The province is also putting the concept of social circles on pause. People are now advised to limit close contact only to those living in their own household. Does that go far enough? Bonnie Crombie is the mayor of Mississauga, Ontario. She joins me from that city. Hi, Mayor Crombie. Good to see you as always.
Hi, Vashi. Thanks for having me once again.
What do you think of the restrictions? Do they, I mean, you know that we're hearing from public health officials in various, depending on where they are, but about perhaps bringing in stricter restrictions. What do you think?
So I think the Premier faced a very difficult decision today, as his modeling is showing that there could be 1,000 cases per day. So obviously he's concerned about the second wave and took action. And I give him credit for that. Here in Peel, the experience is a little bit different. When we entered phase 3, so as we entered and allowed permitted indoor dining as well as outdoor dining, we imposed mandatory masks. We also imposed a 100-person limit in any restaurant and 10 per table. So we had some of those restrictions in place, which have worked well for us. Our experience is a little bit different. We don't see transmission in public-facing businesses the way that Toronto has seen them in restaurants and bars and in lounges. Vashi, our transmission has been occurring still. 92% of cases, new cases, are still community transmission and through households. So the shrinking of the capacity numbers worked very well for us in a private setting, going from the 100 and the 50 outdoor indoor to 25 and 10. That worked very well for us. And so we are on a slow burn here in Peel, holding steady 75 to 100 cases per day in all of Peel. Mississauga is averaging at just over 30. So we're all keeping our fingers crossed. I think we have the right measures in place. And I know that the Premier had that tough decision to make to roll back capacity and make mandatory masks, or face coverings, I should say, mandatory across the province.
So let me circle back to what you were saying about transmission. When you say that 92% is through community, I think you said, right? So
and household.
And household.
And household.
So what you mean is it's
Combined.
not happening because of businesses. Like, it's not happening through businesses, from your information.
Exactly. So when the new measures were imposed 2 weeks ago, we did bylaw blitz. We issued only 25 tickets, and I'll share with you, only 5 of those were in restaurants that had capacity over 100, and only 5 of those restaurants had more than 10 people at a table. The rest of the 25 tickets, there were 2 house parties. There was one park gathering, a picnic that had over 50 people, and the rest were signage related or staff not wearing their mask properly. So it is not occurring in our businesses for the most part. It's still in the community. It's still within households. And you and I both know we had a glorious summer. The weather was nice. and people were becoming a little relaxed with the rules. You know, how many backyard barbecues had you been invited to, or household dinners where there was 10 people at a dinner, and yes, you were physically spaced out and you felt safe, but nonetheless, too much of that was happening. I saw people hugging and air kissing, and I thought, oh, folks, you don't want to be hugging people that you don't see day to day, who aren't in your immediate family. You don't want to be hugging them. So I was getting nervous. And so we did see the numbers edge up as we went into phase 3, and all the businesses were open, the kids were back at school. But now the weather's our friend. It's turning colder, so I hope they stay inside and into only their most immediate circles.
Yeah. Have you seen, since the restrictions, you mentioned the sort of move down from 100 and 50 to 25, et cetera. Have you seen, when those gatherings were limited, was there a big difference, did you find?
Well, certainly we did. We saw the numbers stabilizing, as I said. I mean, they're incrementally creeping up. I agree. We're 75 to 100, as I said, 36 in Mississauga. I looked at the same numbers Eileen Davila looked at today. So at the beginning of Peel, we had only 40. That's Toronto. Peel 38 cases per day, then it grew to 80, and now it's 75 to 100, depending in Peel, and Mississauga a little bit lower, only building at 3 times the key numbers. And Eileen Davila had suggested that Toronto, in the month of September, the numbers increased 6-fold. So where we see the transmission, weddings, yes. So banquet halls, we're concerned about banquet halls. So I'm delighted that the capacity is now limited to 50. Within the banquet hall, not within each room. All right. So we see it in weddings, banquet halls, and in religious places of religious worship. We're cautioning them to continue to be vigilant and continue to be very careful.
And your message to just people at home who are, I think, we were talking about this with the power panel, certainly getting a lot of different messages, but one that seems to be emerging lately is just stop socializing, basically. Stop being with people outside of your address.
Yeah, we call, as we talked about shrinking your social bubble, and who knew that everybody in your bubble also had their bubbles, right? So your immediate family, the people you're home with, and maybe some support people, whether they're PSWs or whoever needs to come into your home, babysitters, etc., the people you work with. Keep it tight as possible. This is not the time to load up your social calendar, please. This is time to cut back on socializing. We're on the cusp now of this second wave, and we can turn things around, particularly here in Peel. I'm very, very hopeful that things don't have to roll back. We've cut capacity numbers, rolled back capacity numbers. Nobody wants to see businesses close again.
Okay, thanks, Mayor. I appreciate your time this evening. Bonnie Crombie is, of course, the Mayor of Mississauga. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.